a lot of women go through pregnancy.
Yes.
I can give my own example. I was with a certain medical aid, which I obviously can't mention, and they gave you a certain amount of money to use per year, and that money has to cater for everything. Let's say I'm pregnant. If I go to the gynecologist, consultation is 2,000 rand, and I get given 8,000 rand to use per year. So when you're pregnant for 9 months, you're expected to go through.
Maybe the visits are a lot.
Yes. Once a month you need to go to the doctor. So just calculating it, 2,000 rand, you only have 4 visits, and that doesn't include medication and all those things. So we need a medical aid that can account for pregnancies, strictly pregnancy, deal with women issues.
Today, I just said, please come in no time, like just 2 seconds, 3 seconds, like, Thembi, I'll be there, because this really is serious matter. So welcome, Dr. Mashadi Motlana.
Thank you so much.
It is really amazing to have you. Thank you so much to grace us with your presence. Your schedule is very busy, but we're talking Sizwe medical aid, and we've been talking about it for a month now. And today we thought, you know what? Let's just get answers. Let's just give our listeners a clear picture. What is Sizwe Medical Aid?
Well, Sizwe Medical Fund was started in 1978.
Yes.
It's got a very proud history. One of the first black established medical aids, founded because the founders realized that black health wasn't well covered and catered for. Today, it's an open scheme. Its membership is all South Africans, but it was born out of a need for caring for the nation. And I'm here to say that we're still caring for the nation in 2017. We think about our people, all our people, especially those on the lower end of the market, for whom medical aids often appear to be unaffordable, but actually may well be affordable. We're not into frills. We don't sell frills. We sell healthcare.
Yes.
If you want a medical aid, we have the right people.
But then now people will say that, there's so many of them out there. What makes this one different? What makes it unique? How is it going to take care of me? Because whatever that's out there is probably too expensive. Or let's say you just, you agree on an agreement. You sign a contract, and later you find out that not actually the amount that they said I have to pay every month, that's not what it is. There's more things that are coming with it. So what makes this one unique? What makes it different?
I think that Sizwe Medical Fund probably has the richest benefits on the market.
Okay.
Our focus is really around healthcare.
Right.
As I said, we're not into the frills. Yes, we've got a loyalty program at last that we've associated ourselves with, but that's not what we sell. We sell good healthcare. And when I say it rich benefits, I think that people often get sold by the marketing of a medical aid, but when they actually need to access care, they find that they've got very few benefits. Give you an example, our low-cost option called Gomomo, which is a network option.
Gomomo.
Yes. Yeah. Actually allows you, for example, for your mental health care benefit, which is of great interest to me as a psychiatrist, allows you to be admitted at a private clinic. In my experience as a psychiatrist, there are few medical aids out there that sell you medical aid and you assume you've got private care. Most people think they'll never have a mental illness. And I remember treating one young man a few years ago, and his medical aid only had the option of being admitted at a state facility for psychiatric care. This is not how we treat our patients. And it was only because there were no beds in any of the state facilities that I was able to admit them in private care. So when we say we've got rich benefits, we truly mean it. And the Gomomo option that is easily affordable at about $850 depending on your income band gives you access to private hospitalization. And while we know we've got preferential arrangements with certain hospital groups, it does not limit you from going to the nearest hospital depending on what kilometer radius you're in, and accessing maternity care, oncology, your PMBs, as you would with the high benefit options. The restriction, the main limitation is on your day-to-day, but when you're young and healthy, usually that's within your acute medicine package. And this medication you can access through your GP, with whom you have unlimited access. So it's the GPs that are the gatekeepers of healthcare costs, because you go to them, they manage your illnesses, and they usually in this network will then dispense the medication. It's in the hospital care where there's unrestricted access.
That's amazing, because not so long ago, I think a week ago, 2 weeks ago, we went to a taxi rank and we did some activation. And the minute we mentioned mentioned 850, and there was, are you sure, Thembi, it's really 850? Really, I will definitely get medication and private hospital, because obviously in the township people are exposed to more of a public hospital. So
Yes.
how true is this? How can 850 really cover so much, because I'll start in Jan and I'll expect if anything would happen to me maybe in 12 months, I don't know if 850 will be enough to cover me in the private hospital.
Yes. So what we do is that we work with actuaries. The fund makes sure that these funds are sustainable. For the young and healthy, it's an extremely affordable option, because we don't expect the young and healthy to be in hospital with chronic, severe illnesses. And that is why it is affordable. I wouldn't recommend this option, for example, someone with cancer, who's elderly, because they need more expensive medication from day to day. They can't be limited to just a network doctor. And so for those, we would want them to be on a higher end option. It's intended for that, something like full benefit. But think about it. You're young and healthy. The most likely hospitalization you'll have is when you're pregnant. So obviously there are limitations. All medical aids would like you to declare if you're planning to have a baby, because we don't want people joining only because they're pregnant. But for all your other needs, you should be able to pay 850. This is for an individual membership, of course. For additional dependents and children, there's an additional fee. So 850 will not cover an entire family, but it will
an individual,
the principal member.
I'm glad also you mentioned about, you mentioned pregnancy and all that, because we had a chat with ladies yesterday, and there was just really interesting questions that came up. And most importantly, it's just, as a woman, there's so many things that you have to do to take care of your body. Number one, gynecologist, pap smear, and all those things. And just the changes, with us, our bodies always changes and doing things. And with lack of understanding, you immediately think, I'm sick, it's an infection, and all of that. So I really want to know if medical aid, like the Sizwe medical aid, really covers all of that. Is there a program where you just maybe, I don't know, is there a way of educating young women out there that, what, there is a solution, there is a space for you?
Well, that's why I'm here today. I really am happy that we've had the opportunity to share this, because often people are intimidated by medical aid because they think it's unaffordable. And there are affordable options. We also, talking about the richness of our benefits, we have a hospital plan option that, even in that option, looks after the maternity care. There's a program, so you're not limited, unlike other medical aids where, there's interaction with the woman during her pregnancy. We send the baby bag. So there are a number of things that we do differently to make sure that we give you the most value for your money. In terms of keeping people well, with all our options, there's a wellness screening part where we encourage people to have their measurements done, check their weight, hypertension, and diabetes and cholesterol. We know that South Africans are increasingly getting obese. We're amongst the fattest in the world. So it starts early. We need to be educated about what a healthy weight is, how to manage our weight, because later the consequences are hypertension, diabetes, and unfortunately mortality.
At what age does it cover? Until what age? Because I know some,
you mean as a dependent? So as an individual, you can be covered
by 18, 16 until
at any age, right? So the restrictions that medical aids usually impose is if you've never been covered before, and you're elderly and you've never, say for example, then we would have some kind of conditions. We'd impose conditions and say, if you have a pre-existing illness, we wouldn't pay for the first year, and there's also a late joiner penalty. But the law does not allow us to say you can't be eligible. Obviously, if you're a dependent, that is, you're at school, you're not earning a living, or you're still studying and you're under 25, you can produce proof that you still need to be paid for by the principal member, probably your parent or the person who you're financially dependent on, and then you don't have to pay a full adult rate, you can pay the child rate. But up until such time as you finish studying and you're independent, then you have to pay as a dependent, as an adult dependent.
Okay, let's say, doctor, family of 5 or family of 6, and having them to pay 850 each. is a special package or special price that Sizwe maybe designs for larger families, because it's really expensive having to pay 850 every month for everyone. Let's say you have 6 kids. It's a lot of money. Are there special packages for families?
Yes, so what happens is that we normally have the principal member rate, the adult dependent, which is usually the spouse or polite partner.
Okay.
And that rate is very similar to it's around 835, the principal or similarly 850, but the children are just under 400, around 400, 500 Rand. I need to check my exact figures. And you pay for the first 3, and the remaining, if you have more children, you don't pay. So you only pay for your first 3 children. So this is how we also go the extra mile to make sure that families can afford medical aid.
How do we get out there? How do we get our people know about the Sizwe medical aid? How do we spread it? Because a lot of people were surprised when we were out there, you know what I mean? And it's been existing for many, many years.
I think what we'd really like is that the youth take it up. You know, there was a time in the 70s and 80s when people were very proud to be a member of Sizwe Medical Aid, because they associated with, our past, our struggle, the fact that it comes from such humble beginnings, a group of doctors, black doctors that sought to make a difference. And Sizwe members then, and we still have them, have been Sizwe members for 30 years. It's the younger generation that we need to capture their hearts and minds, and for them to understand where we've come from, the fact that it is for everybody, but it's looking after everybody's needs. It's not exclusive to a certain group, but that we still care.
To have a medical aid, what are the steps that you have to follow? What does it take? Where do you go? How do you get information? Let's put it out there. I know our listeners are saying, okay, I really want to be part of this. I also want to be covered, because the question has been, are you covered? So please give us that information.
So you can reach Sizwe Medical Aid by calling our number 011 353 3000, go through our call center and make a request to have a broker contact you to be able to sell. If you already have other insurance products, you can contact your broker and say you're interested in this product. If you want to do it yourself, you're free to go out to our website and go in there and have a look. There are application forms. So there are numerous ways to contact us and to get onto Sizwe Medical Fund.